everyone, I'm Dr. Pavithra, Fertility Specialist at GarbhaGudi IVF Center, Jayanagar. Today, I'm going to talk to you about testicular carcinoma. So, testicular carcinoma is on the rise and it is seen between the age groups of 15 to 45 years. So, we don't really see it before puberty and also not in the older age groups. So, what are the risk factors for this tumor? Coming to cryptorchidism. So what is this cryptorchidism? It is basically undescended testis. Generally the testis, when it is developing in the male, it develops and it's present in the abdomen. So what happens is it has to descend down and get into the scrotum. So when this fails to happen, it is called as undescended testis, and this has to be surgically treated. It should be treated within 1 year of age group so that the function of the testis is also maintained. But if not, at least it has to be removed and placed in the scrotum or removed completely. Why? Because it can transform into carcinoma. So that is one of the risk factors. Coming to other things like family history, most of the tumors are familial. And apart from that, genetic meaning Klinefelter syndrome, these patients are also more prone for testicular cancer. Apart from that, past infections like it could be human papilloma virus, HIV, cytomegalovirus, or also it could be then Ebola virus. So these are sexually transmitted diseases which again contribute to the testicular carcinoma. Apart from that, it could be even trauma or it could be any injury to the testis. So these are some of the risk factors when it comes to testicular carcinoma. So coming to the symptoms. Symptoms would be generally when we think of cancer, it is some tumor. So if there is any mass or a tumor when you self-examine your testis, so that time it is very important to note these points. So usually it is even painless. It will just be a small swelling. We cannot move it up, separated from that of the testis, and also the pain is also minimal. Around only 5% of the patients experience the pain, and if at all it is there also, it will be a dull aching pain. Apart from that, there could be other generalized symptoms like abdominal discomfort. So that could be a feeling of heaviness in the lower abdomen. Apart from that, if it is a hormone secreting tumor, that is 5% of this testicular cancer could be because of germ cell tumors. So that again could contribute to some of the symptoms. Like for example, hormone secreting tumors would be HCG, or it could be the LDH, or it could be even the alpha fetoproteins. So when it comes to HCG, so this is one of the commonest hormones which is secreted by the testicular cancer. So the symptoms would be gynecomastia, that is breast development in the male. So there is enlarged breast. Apart from that, this hormone HCG mimics that of the thyroid hormone. So because of that, it goes and acts on the thyroid gland and starts to produce thyroid hormones. So because of that, it produces hyperthyroid-like features. It could be hand tremors, it could be because of sweating, excessive sweating, sudden weight loss, or even palpitations and increase in the heart rate. So these are some of the symptoms which these patients face. So how do we come to a diagnosis? Always diagnosis is when we investigate. So first would be the examination. With the examination, we go ahead with the ultrasound. From ultrasound, whether if it is we want to identify if it is a hormonal tumor, we do the basic hormonal tumor markers. Apart from that, the last thing would be the biopsy to confirm whether it is a benign or a cancerous tumor. So once the confirmation happens, treatment options are surgical removal. So once we surgically remove the tumor, we check for the tumor margins. If everything is clear, there is no need to go for chemotherapy or radiotherapy. But if there is some amount traces of the tumor, or if it is metastasized, that is it spread to the other organs through the blood or the lymph nodes, that is even could be to the lungs, the abdominal organs, it could even go up the spine and into the brain. So if there is some metastasis, then chemotherapy is the key. So apart from that, once the surgery is done, the prognosis seems to be good. Around 90 to 95% of survival rate is also seen for the tumor. So always remember that self-examination is very important and prevention is better than cure. So please visit your nearby doctor if you find these symptoms. Thank you.